Hey everyone, Tony Ambler from NASM here, and what we're going to go over today is a variation of the side-lying leg raise or wall slide exercise. This exercise is great to enhance the activation of the glute medius. So any clients who have the knees cave-in compensation, whether you're working with a fitness client or you're doing corrective exercise programming, this is a great exercise to recondition the glute medius before you do more functional standing-based exercises. One of the challenges with the traditional wall slide is that it can be difficult for the clients to keep their heel against the wall. The other challenge is, depending on the environment and the facility in which you work, they may not appreciate sneaker scuffs on the wall as a result of doing this exercise. So what we're going to do is we're going to incorporate a stability ball into this exercise. So if you can imagine that this is a wall, you're going to position your client in the same way that you would for the traditional side-lying leg raise. However, instead of having their heel against the wall, they're going to have their heel and lower leg against the stability ball. And what's great about the stability ball is that it provides some tactile feedback to ensure that the client can engage the glutes appropriately to maintain proper form during the exercise. Also, because of the curvilinear surface of the ball and shape of the ball, it also allows the hip to go into some external rotation as they're abducting, which is great to enhance the activity of the posterior fibers of the glute medius, which is really what we're after when we're doing this exercise. So in terms of setup, you want to ensure that the body is in a nice and straight line from head to toe. So we want the head to heel in a nice and straight line, and we want to ensure that the top leg, which is the leg that we'll be working, can be positioned in to slight extension. So again, in order to maximize the activation of the glutes, we want to ensure that the hip is not flexed at all during this exercise. So we want the leg at the very least in neutral, but ideally in slight extension. So your client's going to be positioned slightly anterior, maybe a little bit further away from the wall than they typically would if they were keeping their heel against the wall. But in this case, we have the small stability ball here, and that'll require your client to be positioned a little bit further in front of the wall. So you want to make sure that the bottom leg is nice and stable and that the trunk and torso is in a nice straight line in relation to the top leg. You want the heel and lower leg positioned against the ball. If you have the ball a little bit closer to the knee, that can also be viewed as a regression because you're in essence shortening the lever arm a little bit, and it might make it easier for your clients to move their leg up and down. So once your client's in the proper position, you want to ensure that their abs are drawn in so their core is nice and stable, and that their quadricep and knee is, your quadricep is locked and tight so the knee is fully extended. And once they have that setup position, they're simply going to press against the ball and raise their leg as high as they can without compensating through the rest of the kinetic chain. You can have them hold at the top for 1 to 2 seconds and then slowly return the leg to the starting position and repeat for the recommended number of repetitions. A couple things to watch out for from a technique standpoint. You don't want the client to go so high that they start to hike at their hip, which can involve the quadratus lumborum as a synergist to the glutes. You also want to ensure that the knee doesn't flex at all and doesn't bend, which can in turn enhance activation of the biceps femoris, which is another synergistic muscle that compensates for the glute medius. So you want to keep the knee fully extended, the toes pulled up into, the foot pulled up into dorsiflexion while you have them complete the exercise. So again, nice slow and controlled tempo, pausing at the top, and then slowly returning to the starting position. So there you have it, side-lying leg raise with the addition of a stability ball to help enhance your client's success and ultimately the effectiveness of this technique for activating the glute medius.